So let's start with the application process. It's actually very straightforward, as daunting as it may seem. I think the most important thing is at the moment, these medicines are available to anyone who has had a chronic health condition for more than 3 months. I won't list them all, but that information is on the website or it's easily accessible. Anxiety, PTSD, irritable bowel, insomnia, chronic pain, neuropathic pain. You know, there's a huge amount, and it really does cover most ailments that people actually suffer from. So if you've had one of those for 3 months and you would like to try cannabinoid medicine, then you need to talk to your regular GP and arrange for that information to be sent to me or any other practitioner in the country who's doing this. And then from that point, we have the evidence that we need to apply to the TGA for use of these medicines. So that's kind of the initial screening process. After that's done, there's an appointment, and that's a long conversation about your health and your goals and your aims and what's happened in your life and how you think this might work for you. And then from there, we'll talk about the different medicines available and how we think they might work. And there's lots, you know. Essentially, it's medicinal cannabis, and the two major components of that are THC and CBD, and then that comes in formulations as oils, soft gel caps, flowers, sprays, and fairly soon we'll have suppositories, wafers, aerosols and creams. So depending on the ailment and some other aspects of the patient, we can work out a program that's basically unique to everybody. And you know, the science is early and the medicines are still undergoing research. So from that perspective, it's a slow process of working out what's working and what's not. I mean, everyone's unique. Everyone's endocannabinoid system's unique. And if you want to think of it in terms of a disorder of the endocannabinoid system, that's unique for everyone, and there's no way to really test it other than starting to treat it. So we'll start with very low doses, we'll go very slowly, and then it's a very intimate relationship with the prescribing doctor just to work out how you're going and, you know, where you need to get to, what's working, what's not. And then over the course of time, the idea is to bring that endocannabinoid system back into, we could say, natural homeostasis, which is balance. So our endocannabinoid system is in our brains, in our immune system, and it's basically there to return our bodies to balance. It keeps the balance. When we make bad decisions about our diet or when we have emotional trauma, stress, it throws that endocannabinoid system out, and quite often it can't then get back into balance because those offending injuries are still reoccurring, which goes back to the integrative medicine and removing some of those influences. But over time, we should be able to bring that system back into balance, bring the body back to a kind of state of homeostatic health by which it can then just do the job on its own. But that's not just the medicine, that's diet, exercise, emotional trauma, sympathetic nervous system activation, all these kind of all these elements that are not allowing us to be balanced and whole, basically.